Good evening, good afternoon everyone, and welcome to today's webinar on health literacy, part of an internal webinar series from the joint action PreventNCD. This is the first webinar of 2025, and we're excited to kick off the year with such an both interesting and valuable topic. And stay tuned for more webinars through the year, as this series will continue and highlight key aspects of the work we're doing in our joint action. We're glad you could join us today, and we look forward to sharing some insights into what we think is a very important topic on health literacy, an area which is critical to reducing health inequalities and improving health outcomes across Europe. My name is Peder Ringnes Berrefjord. I work at the Norwegian Health Directorate, and I'll be moderating today's session. And while this webinar is not interactive, I put my contact information on this slide, and this will also be shown at the end of the presentation. And please don't hesitate to reach out after the webinar if you have questions, comments, or ideas for collaboration. The purpose of these internal webinars is not only just for us to share what we're working on, but also to create some kind of a dialogue and encourage a collaboration across the joint action and our work packages. Health literacy is a cornerstone of our efforts to address health inequalities and support prevention across Europe. Its relevance extends far beyond our task, and therefore it's especially important that you think about this throughout the presentation, how this can sort of intersect with your own work and how we can work together to further prevention of NCDs across Europe. Just a quick look at today's agenda. We'll begin with an overview of the health literacy task in the joint action, and then we'll briefly introduce the concept of health literacy, what it is and why it is important. After that, we'll move on to two thematic presentations, one on organizational health literacy and another on mental health literacy. And each presentation will offer practical insights and examples of how health literacy can make a tangible difference in systems and communities. And we hope you find these sessions both informative and interesting. So let's first take a look at how health literacy is organized in our joint action. So the aim of this task is to build capacity at both individual and organizational level, empowering stakeholders to access and act on health information effectively. Our work is part of a broader European effort to address inequalities in NCDs, and is organized under the work package 7 on social inequalities. By integrating health literacy into policies, systems, and services, we can ensure better access to health information, improved health outcomes, and ultimately reduce disparities. As you can see from the list of subtasks here, the scope of this task is broader than the two themes we will talk about today. However, our goal is that this webinar will showcase some of the work we're doing and also encourage you to explore potential connections with your own areas of expertise. We believe this task has significant potential to connect with other work packages and within our joint action, opening doors for collaboration and innovation across the joint action. So with that, I just want to dive into what actually health literacy is and why it's important. And this might be familiar to some of you, but I think it's important to go through regardless. So what is health literacy? And health literacy is defined as the knowledge, motivation, and skills individual needs to access, understand, appraise, and apply health information to make informed decisions about their health. It's important to note that health literacy is not just an individual responsibility, it's a shared responsibility between individuals, organizations, and also policymakers. Think of it this way. It's about us as individuals navigating a complex health system, and the health system in turn understanding and accommodating for us, for our complexity. For example, clear communication from healthcare providers and user-friendly systems can empower people to manage their health more effectively. This dual responsibility is why health literacy is such a powerful tool for improving public health and making better health outcomes across Europe. So why is this important? To begin with, health literacy is a critical tool for addressing health inequalities. Individuals with low health literacy face more significant challenges in navigating the health system, understanding treatment options, and adhering to prescribed treatment. This does not only impact their health outcomes, but also create disparities across communities. Health literacy also plays a key role in prevention. When people are equipped with the right knowledge and skills, they're more likely to engage in preventing behaviors, like attending regular screenings, or adopting healthier lifestyles, or managing risk factors in their life. And prevention is the cornerstone, as many of you know, in reducing the burden of NCDs. And health literacy is central in making that happen. On a system level, improved health literacy can lead to more efficient use of healthcare resources. For example, reducing unnecessary hospital visits or enabling better self-management of chronic diseases. This has a direct impact on cost saving for governments and organizations, which is particularly important in a resource-limited setting. Moreover, health literacy supports patient empowerment and shared decision-making. Informed individuals can better communicate with healthcare professionals, ask the right questions, and actively participate in decisions about their own health. This does not only improve health outcomes, but also build trust and satisfaction within the healthcare system. And finally, improving health literacy contributes to public health resilience. So, for example, in times of crisis, like the COVID pandemic, which we've just been through, clear communication and a health literate population are essential for disseminating accurate information and combating misinformation. It enables communities to act swiftly and effectively, safeguarding both individuals and communities. So, in summary, health literacy operates on many levels: individual, organizational, and systemic. And its benefits are far-reaching. It's not just a tool for understanding health information, it's also a catalyst for change that drives equity, efficiency, and empowerment in public health. So now I hope that you're a bit intrigued and you want to learn more, and that you're also looking forward to our more sort of in-depth presentations. So we will have, in today's webinar, we will explore two sort of key areas within health literacy. The first one is on organizational health literacy, which will be presented by Christa Straßmayr from the Austrian National Public Health Institute. She's also the subtask lead for the subtask related to organizational health literacy. And after that, we will hear about mental health literacy, which will be presented by Johanna Cresswell-Smith from the Finnish Institute of Health and Welfare. And she is the subtask lead of the subtask related to mental health. And we do hope that these presentations will inspire you to consider how health literacy might intersect with your own work areas. So we'll start with Christa. Christa, are you ready?
I'm ready.
Perfect.
Thank you very much, Peder, for the introduction. I will share my slides. Let's see. Can you see my...
Yes.
Oops. Can you see my slide?
Yes.
Wonderful.
Perfect, Christa. Thank you.
Thank you very much, Peder, for the introduction. A warm welcome to everybody from my side. Peder already introduced myself. I just would like to say that I'm holding this presentation on behalf of the participants of the subtask 7.4.4. And I'll give you a short outline on what I will be presenting. I will start with some background on organizational health literacy in healthcare organization. Then I would like to give some examples on what can actually healthcare organizations do to enhance organizational health literacy. And then I will provide you some insights into our work in the Joint Action PreventNCD, tell you about our aims, but also present some results of the work that we did already in 2024, where we had held some expert interviews and where we performed a mapping on national information and activities on organizational health literacy in healthcare services, and also give you some outlook on the next steps. So let me start with the background. As for organizational health literacy, it can be described as the degree to which healthcare organizations equitable empower people through organizational structures, policies, and processes to find, understand, appraise, and use information and services to make health-related decisions and actions for themselves and for others. So by becoming health literacy friendly or health literate responsive, healthcare organizations can better meet the need of the users. Organizational health literacy promotes person-centered care, it promotes empowerment, patient safety, and it promotes health equity. Becoming a health literate organization requires a readiness for structural change, for an organizational development, and this should be part of an organizational quality development. Organizational health literacy that does not only address the needs of patients, but also of employees. Organizational health literacy is also directed towards management and to the population that a healthcare service serves. So why should we actually focus on organizational health literacy, specifically in healthcare organizations? So because a considerable number of patients have low health literacy. And we know that patients with low health literacy have a higher use of healthcare services and they do have worse outcomes. And low health literacy has considerable consequences for the costs of healthcare. So as for the characteristics of a health literate healthcare organization, what are they? So a health literate healthcare organization incorporates health literacy into the management and organizational structure. So the focus here is on management and organizational structure. It provides easy access to the organization and facilitates navigation, so headline navigation. It communicates in clear and easy to understand language, so it's about communication. It promotes the health literacy of the users, so it's about users, patients. It promotes health literacy of staff members, it's about staff. It promotes activities in the organization regarding health literacy, so it's about further activities, it's about outreach activities, and it promotes digital health literacy. I think this can be best explained by some examples. So and that's what I will do now, I will show you some examples. What can healthcare organizations actually do to enhance their organizational health literacy? So how can healthcare organizations incorporate health literacy into the management in the organizational structure? They can do that by defining health literacy as an organizational responsibility, e.g., they can do that in a mission statement, in policies, in business goals. They can appoint a designated person who is responsible for coordinating the health literacy efforts of their organization. And of course, they can integrate organizational health literacy into quality management systems by regular assessments. Here are some examples on how organizations can provide easy access to the organization and how they can facilitate navigation. They can look at their websites and make them user-friendly, even for people with poor digital competences, as well as for people with physical and cognitive disabilities. They can offer easily accessible and understandable information about the organization's location and about the journey to the organization. And they can apply wording and symbols in their signage which are commonly used by patients. For example, instead of saying nephrology ward, they could use wordings like kidney ward. Some examples on what to do to communicate in clear and easy to understand language. So all major written, audiovisual, or digital materials should be available in the languages of the relevant patient groups. Patients can be supported to note down important information from conversations. For example, some services have special booklets on that. And patients can be explicitly encouraged to ask questions. And for example, the Ask Me 3 campaign could be used, which is an educational program that encourages patients and families to ask 3 specific questions to their providers. For example, these questions are, what is my main problem? What do I need to do? And why it is important for me to do this? Here are some examples on how health literacy of users can be promoted by healthcare organizations. For example, they can provide information to users about possible ways how they actively can deal with their specific health condition. They can offer trainings on coping with chronic diseases, and they can develop procedures to identify vulnerable patients and determine which health literacy needs they have in order to reduce inequalities in the healthcare services. Some examples on how organizational health literacy of organizations can do to promote health literacy of staff members. They can train staff on person-centered communication. Trainings could focus on reconfirmation techniques to ensure that staff and users have understood the context of the conversation. This could be a training on encouraging questions, on active listening, or on teach back or junk and check, some specific techniques. And of course, the healthcare staff can be supported to develop and maintain a healthy lifestyle. Here are some examples on further activities of the organization regarding health literacy. So healthcare organization can make health literacy activities and outcomes part of their organization's public reporting. They can provide evidence-based and non-commercial information about relevant health topics to the local community that the organization is serving, for example, through health fairs, through public lectures. And of course, they can participate in health literacy research and development projects. And as the final characteristics about how to promote digital health literacy, here are 2 examples. For example, the organization can facilitate staff trainings regarding the use of digital services and new media. And if digital home follow-up is used, the organization can ensure that users receive sufficient instruction to use such services. So basically, it is important to mention that organizational health literacy is not one single example that I just shown, but it's the whole package. So not just a single intervention. Of course, a healthcare organization would start with one or the other intervention, would put the focus on one area, but when transforming into a health literacy responsive organization, it is important that the full organization has this commitment, that the organization wants to adapt its structures, its policies, its processes for a sustainable change in order to support patients and staff to take health literate decisions. So as the next, I would like to give you a bit of insight into our work in the Joint Action PreventNCD. Peder already gave an overview, but just once more, just to see that where our subtask is actually located in the joint action. So we are part of work package 7, and the subtask, overarching subtask, is strengthening health literacy to reduce inequalities in cancer and NCDs. And there we are, the subtask 744, and our name is Tools and Evidence for Promoting Organizational Health Literacy. We are altogether 7 countries. Thereof, we have 1 observing countries, which basically was already also very active in 2024. So, but just to name the participants or the countries from where we have participants, it's Austria, it's Finland, it's France with the observer country, Hungary, Italy is joining with 2 organizations or 2 institutes, Norway and our Ukraine partners. The aim of our subtask is to support the implementation of internationally developed standards for organizational health literacy in healthcare organizations and to provide evidence on how healthcare organizations can enhance their health literacy responsiveness. And by focusing on improving organizational health literacy, healthcare organizations' responsiveness to the needs of patients with cancer and NCDs should be strengthened. In 2024, we performed 2 activities. We held interviews with relevant stakeholders, experts, on facilitating factors for enhancing organizational health literacy and for the uptake of organizational health literacy assessments. The latter because we want to do such assessments this year. And as a second task, we did some mapping of literature and national information, materials, tools, and activities on organizational health literacy in healthcare organizations. And as for the interviews were performed in 6 countries, in Austria, France, Hungary, Italy, Norway, and the Ukraine. They were done a little bit different in the countries. So some were held online face-to-face or sometimes also mixed and personal face-to-face interviews. Some countries did the interviews as online service or as mail service. And 1 country held the interviews as part of workshops. A total of 83 stakeholders, experts were interviewed, and the interview contents were summarized into main results and translated to English, and we used thematic analysis. So just to get an idea, who were the people that we interviewed, what was their professional background, what was their expert knowledge. So people could have, of course, different areas of knowledge. So the number or the bars that you can see here do not correspond with the number of the experts interviewed. It's higher because experts could have in more than 1 field expertise. But you can see that 21 of the experts were experts in health literacy, 19 in NCDs and or in cancer prevention. 16 experts had a background from healthcare service management, and I wouldn't name all of them, but we also had 5 patient representatives, just to give you some idea who we were talking to. To show you some results on factors that facilitate the transformation of healthcare organization into health literacy responsive organizations, we identified internal and external factors, so the factors within the hospital and factors which are from outside the organization, outside the healthcare organization. It's not just hospitals. So looking at what facilitates the becoming a health literate healthcare organization from outside, well, basically, if there is a commitment to improve health literacy in a country, and if health literacy awareness is considered high, this will be also beneficial for organizational health literacy. And the same is true if health literacy interventions already exist in a country, in an area. So this will also be beneficial for organizational health literacy. Experts considered it crucial that we need to shift from a narrow focus on care to a broader, inclusive approach grounded in health promotion principles. So recognizing health literacy as a cross-cutting issue was brought forward by the experts. And awareness rising for health literacy includes that the benefits of high health literacy are highlighted, of course, also as the risk of low health literacy. An expert also said that this is also part of this awareness, that regular measurement of health literacy status in a country and its progress are considered as facilitators for organizational health literacy. Also, it was considered important that organizational health literacy is anchored in policies and legislation, and if organizational health literacy should be enhanced, we need tools, so the availability of tools, including digital tools, the availability of guidance, of educational support on organizational health literacy, and support on how organizational health literacy intervention should be performed, were considered important. And also it's beneficial if health literacy networks already exist. And basically experts also said that it is important that a community of practice is built to enhance organizational health literacy. And last but not least on this slide, if organizational health literacy assessment should be successful, it could be also popularized by offering a kind of certification or accreditation process. So let me tell you some aspects or factors that were named by the experts on from inside the organization that would facilitate organizational health literacy. So basically, management and leadership support are very important. For example, to incorporate health literacy and health promotion principles in the strategic vision of the organization, and to facilitate a health literate friendly culture and health literacy friendly working conditions. To enhance organizational health literacy, an organizational culture that values the principles of organizational health literacy are key factors, and this includes promoting teamwork, but also something like a culture that would allow to challenge established practices and structures. Facilitating factors are important, also in the sense of that you need financial and personal resources for the development of organizational health literacy. Experts mentioned about staff education, that trainings are considered essential, that staff get an idea about what is organizational health literacy, and that they receive tools how to enhance organizational health literacy. Also, a commitment to patient education and participation is needed. And this could, for example, include collecting information about patients' health literacy and adapting information to their needs, providing it at the right time and in the right situation. So these are some internal factors. Let me show you now some results on the mapping that we did. We did some mapping in altogether 7 areas. The first areas were policy framework, supporting organizational health literacy responsiveness. We looked at the current state of national organizational health literacy in the healthcare services. We were looking at tools and supportive documents and materials, at interventions, at evaluation and monitoring, at cooperation nationally and internationally, and at research. Altogether, 5 countries participate in this mapping, and I would like to just knowing that there's a lot of information in this graph, but just highlight the part which is on tools and supportive documents, also because we are in our subtask, this is an important part of our work in this year. So, for example, you can see here that if assessment or measurement tools in the national language to assess organizational health literacy were available in 3 countries. Considering supporting documents, we could find supporting documents in 2 countries. And if we consider organizational health literacy related issues, so which could be something that is just referring to one part of organizational health literacy, for example, on the part of clear communication, then we found actually supporting documents in 4 countries. And we were also checking if there is an implementation strategy in any of these countries on organizational health literacy, and none of the countries had any. So let me give you a few conclusions from our activities. So maybe basically overall these activities had an explorative character and supported the subtask participants to get insights into the field of organizational health literacy in their country. And in addition, by doing the interviews, national stakeholders' attention could be drawn already to the aims and activities of our work. And this is also an important first step into the field work that we'll be doing this year. As for conclusions from the interviews, organizational health literacy transformation and development processes are facilitated and impacted by factors both outside and inside the healthcare organization, and basically a strong mandate from leadership is required for a successful application of organizational health literacy interventions and assessments. And organizational health literacy is a multidisciplinary issue that requires efforts from and exchange with a broad range of stakeholders inside and outside the organization. There is no one size fits all, and interventions benefit from being tailored to specific needs of users, of organizations, and of countries. And as for the mapping, we can conclude that most countries engage in organizational health literate related activities, which means related to some aspects of the concept of organizational health literacy, but a direct inclusion or mention of organizational health literacy in policies, in strategies, or in activities or specific actions that support organizational health literacy development are less common. So, coming to an end, just to give you a short outlook on what we will be doing this year. So currently we are producing a fact sheet and a paper on the results of the activities that we performed in 2024. And this year we will conduct organizational health literacy assessments in healthcare organizations. So we really do some field work because we want to identify organizational health literacy strengths and challenges and needs, and we will use the international self-assessment tools from the MPOL network. Summing up, why we want to enhance organizational health literacy, so basically what we want to reduce requirements and complexities, as Peder was telling us at the beginning in his introduction. And we do that by improving organizational structures, strategies, and processes. Especially vulnerable populations or those with low individual health literacy can benefit the most from such improvements. Organizational health literacy enables healthcare organizations to better meet the need of users, of staff, and of the community. And the interventions have the potential to promote health equity and empowerment among healthcare service users. So organizational health literacy interventions can contribute to reducing health inequalities in cancer and NCDs. Thank you very much for your attention.
Thank you, Christa. Thank you for that interesting presentation, and it was great to get some examples and also to see all the work you've been doing in 2024. As we're a bit short on time, I do have some questions, but I think we'll save it to the end. So stay on the line, Christa. But now I'll give the floor over to Johanna Cresswell-Smith from the Finnish Institute of Health and Welfare, and she will present the work on mental health literacy. So, Johanna, the stage is yours.
Thank you very much. I'm just trying to upload my slides. Just give me a couple of minutes. Well, not a couple of minutes, but a small moment. There we go, something's happening. Thank you so much for the opportunity to come and talk about my small part in this very large project. My name is Johanna Cresswell-Smith, and I am, as Peder said, from the Finnish Institute for Health and Welfare.
Excuse me. Your PowerPoint hasn't popped up yet.
It hasn't?
Nope. Now it came up.
Now?
Just took some time.
Okay, good. Oh, good. Thank you. Sorry, it came up for me, but...
Oh, all good. We got it. Thank you.
Kept you guys in suspense. Thank you so much. So yeah, from the Finnish Institute for Health and Welfare. And my small part in this large project is to look at mental health literacy. And I'll tell you a little bit more about what we're developing, but I will start off with a sort of more general overview of looking at mental health as an NCD. I'm not doing this on my own at THL, thank goodness. I'm together with my two colleagues, Pia Solin and Sebastian Terman, who will be looking. Pia will be is working alongside me with all of these tasks, and Sebastian will be looking more when we get to the point of analysis and psychometrics and that kind of thing. So a team approach to this task. So if I just start off just very generally talking about mental health as an NCD, already back in 1954, Dr. Chisholm, the first general director of the WHO, coined or said the famous and important words that there is no health without mental health. And this is a sort of citation that is used quite a lot, that highlights the fact that that physical health and mental health are intimately linked. And this is something that's been adopted in numerous different policies and strategies throughout the decades, and sort of an underlining foundation for a lot of the work that we do. But this isn't, I mean, it hasn't always been the case, and mental health has not always been viewed as an NCD in its own right. But more recently, after 2018, it has actually been included in a wider global NCD agenda, and it has also been included in various different targets, for example, the UN Sustainable Development Goals, which sets out, of course, to reduce premature mortality from NCDs, but also states that it wishes to promote mental health and well-being. So on many different levels, mental health as an NCD is a very sort of relevant and timely action. This framework illustrates how the traditional or the previous 4x4 model, which had more focus on cardiovascular health and respiratory diseases, cancer, diabetes, and so on, was expanded to include mental health as a sort of disease factor, and then also included air pollution as a risk factor. And this was done in 2018. So broadening the view both in terms of the diseases, but also in terms of the risk factors, which can go in each other and can be very relevant to, of course, many different outcomes. I also believe that there's a 6x6 dimension coming or be under discussion at the moment, which our partners who are involved in dental health will know more about, but that would be to include oral health into this framework. So broadening and looking at different aspects of health is kind of the context that we're working in. In joint action, we include mental health in this work package, in work package 7, and also in work package 9, and perhaps elsewhere. It's so large that I'm not completely aware of where mental health pops up. But in general, if there is anyone who is working with mental health in whatever form, I'd be really interested to hear about it, and I'd be really interested to collaborate if there's anything we can collaborate on. But I'll tell you a little bit more specific about the joint action task in just a little bit. Just to go through a couple more slides on sort of why it's important to attend to mental health as well as the other NCDs that I just discussed. So mental health has been shown to contribute to quite a large chunk of the burden of disease. Already in 2007, in the Global Burden of Disease study, this picture was painted where you can see that there's, of course, many different types of physical diseases, many NCDs in there as well. But this area that's been highlighted here, this triangle in sort of a blue color here, represents neuropsychiatric disorders, which is quite a broad definition, but in there, there's numerous different types of mental disorders. For example, this purple area here represents depressive disorders, and does sort of contribute to the largest part of neuropsychiatric disorders. So we can see that mental health is a very relevant outcome to focus on. And something that has been lifted already for quite some time. Here is a newer study of the global burden of disease from 2019. It doesn't have the same or a comparative diagram to compare to, but here, this one just including mental disorders, it shows that mental disorders remains along the top 10 leading causes of burden worldwide. And unfortunately, there's no evidence to say that this would be sort of going down or reducing. So it's very relevant and highly timely to discuss. And we can see here in this picture, when we look at if we look at the vertical axis there, which denotes age, we can see here that a lot of the burden exists in those adult years when we should be living or we should be as productive as we can be in terms of family or work or volunteering or community, whatever we do in our everyday life. So the burden really hits us when we need to be at our most effective. So highly timely to talk about mental health. Why include mental health as an NCD? Well, we can see that there's a lot of evidence to show the burden of mental health disorders, but also that NCDs and mental disorders often coexist and overlap. Also, their risk factors overlap. We also know that there's increased mortality for people with mental disorders, and here there are very strong links to other NCDs or other physical diseases, but also stigma relating to treatment. And here I can find sort of synergies with what Christa just told us about when it comes to organizational health literacy. It's also very important or timely to talk about mental health for the same reasons that Christa just told us about earlier, because the organization or the context in which we do things is, of course, highly influential on the outcome. So we know that even in healthcare organizations, the stigma related to mental disorders does contribute to the premature mortality for this group. So the comorbidity and all the causal mechanisms are increasingly being understood and can be targeted. And this also kind of leans into new policy documents, for example, EU's comprehensive approach to mental health, which takes a very broad approach to mental health, looking at risk factors, of course, prevention, but also in terms of settings. So looking at more broader determinants of mental health. What is it about our daily lives that influences our mental health? So looking at promoting mental health within everyday areas and everyday settings such as schools and workplaces, everywhere that we exist. And highlight some as key opportunities for mental health promotion and prevention of ill health. And it also highlights this important point. Well, what we think, of course, is a very important point is this capacity building, which is about awareness raising, increasing people's understanding about mental health, increasing people's understanding about mental ill health, and thereby reducing mental health related stigma, which can have a very destructive impact on help seeking, quality of life, a lot of different very important factors. It also talks about a cross-sectional approach, so looking at different policy areas, and this comprehensive approach to mental health is very comprehensive and very broad. It has 20 individual flagships initiatives and has promised 1.2 billion in funding, which of course is very good news. So a lot is being done at the moment. We mental health literacy has been around for a while, but I feel just listening to Christa, I feel a little bit jealous because I feel like we haven't come quite as far, although there is a lot of synergies and we can definitely learn from the work that has been done in health literacy arenas. So one step in our little part in this big process is all about capacity building. So we're picking up that capacity building point from the comprehensive strategy, and we're trying to do something about that within our joint action task. So just starting by defining mental health literacy, it's a little bit of it's not tricky. There are existing definitions of mental health literacy. One thing we would like to do within our task is to refine it a little further and develop the definition a little bit further. One of the most recent definitions sort of looks at mental health, aligns with health literacy and looks at mental health literacy along 4 dimensions. So that's looking at how to obtain and maintain mental health, understanding mental disorders and their treatments, again looking at stigma and understanding its impact on daily life and how it relates to mental disorders, and also looking at help seeking and how increased mental health literacy should mean increased help seeking. So the more we know about any illness, including mental health related illnesses, the more likely we are to seek help, the more likely we are to know that there is help available and that you can recover from mental health related issues. So having said that, one of the most common definitions, or the most common definitions of mental health literacy, tends to focus on mental disorders. So O'Connor summarized in a paper the approach being largely around recognition of mental disorders, looking at risk factors and causes, appropriate treatments, which of course is very relevant and very much needed. But it does promote a sort of more biogenetic conceptualization of mental illness. So focusing on mental health difficulties as more of a medical or a health related, a sort of health sector related issue, which it is to a certain degree. And we don't want to, we don't want to throw this approach away in any way, but we would like to develop it a little bit further. So this more traditional approach or original approach has been criticized a little bit for being a little bit narrow. and that it hasn't included things that are linked to positive health behaviors or positive mental health. So this is a step that we would like to take within our work in joint action. This is based on a review that we did a couple of years ago already at THL. And I'm sorry, this picture is maybe a little bit small for you. But we here highlight how we went through different definitions of mental health literacy. We went through different scales of mental health literacy, of measuring mental health literacy. And we found that there are very few, there are a couple, but there are very few scales that focus on what we call positive mental health, which is, if I just jump onto this one for a second, it follows a sort of dual continuum approach, which views mental health as having two different continuums. Yes, we have the horizontal one here, which denotes mental health disorders, or kind of is a continuum where you can perhaps have a mental health disorder or not have a mental health disorder. Back in the day, originally, years back, we only had one continuum. So we existed on this horizontal continuum, with the difference that we viewed positive mental health as the opposite of mental health disorders. But now we've realized, or it was, of course, Keyes that put forward the theory that mental ill health and positive mental health are actually two different continuums, and they're not opposites of each other. And we need attention to both of them. And this is a very important insight, because it means it gives us a very clear framework for how we will work with mental health. So when we're working with mental health disorders, yes, we will, of course, need a broad approach there too. But mental health disorders might need some level of perhaps therapeutic intervention, some sort of healthcare-related interventions for recovery. But alongside that, we need things that feel meaningful for us. We need a positive everyday environment where we can live. And it really highlights the more social determinants of mental health. So looking broader than just work within the healthcare sector. So this is how we are also framing our work around our comprehensive mental health literacy scale. So we're trying to include both continuums. So yes, we'll learn from the more traditional scales, which focuses more on ill health, but to that we will try to add items which focus on or ask about positive mental health. So this fits very nicely into the Keyes dual continuum model of mental health, but also again builds on another important output from the WHO, which links mental and physical health. And highlight again the fact that mental health is much more than just the absence of mental disorders or disabilities. It's a larger approach. So just quickly running through, I know that we're tight on time, running through our outputs and what we're doing at the moment. We haven't come quite as far as Christa and her team. I'm a little bit jealous there again. They've done a lot of work already. We are still, we've come a long way with defining our sort of initial steps, and that is conducting an umbrella review. There's already quite a few systematic reviews about mental health literacy, so we are going to try and summarize what's already been reviewed about mental health literacy within an umbrella review. And the idea here is to understand even further what kind of definitions and how mental health literacy conceptualizations have been used, and from there build a new scale. So the umbrella review helps us to again define this conceptual clarity, which is a little bit, it's not universal as yet. There are quite a few different concepts going around. and we can also really review in quite a succinct way how this concept of mental health literacy has been used throughout different studies. And what we will need, following from that, we will develop the actual items. So we will compile a list of questions that we want to ask relating to mental health literacy. And then we'll need to test these items. And this is where I ask for help from the team. We've already had some interest from our Work Package 7 pilots, which is really amazing and really nice. Mental health seems to be relevant in many, of course, in many of the different work packages and tasks within the joint action. And what would be really amazing would be to be able to include our scale for testing in any pilot work that might be available. Our only criteria is that it's an adult participant group, and it can really be the general public, or it can be more targeted groups. We're not looking to test this purely in any risk groups. For example, we're not looking at only testing it for people with mental health difficulties. We're looking at testing it in the general population. And we promise the scale won't be very long. We are very hard trying to fit it into 10 to 15 items. So it shouldn't be very taxing for participants. And the content of the scale will be very light. So it shouldn't cause, in terms of ethical considerations, it should be quite a user-friendly scale to add to any pilots. So in the next few steps this year, we'll be focusing on defining the scale, and then 2026, we'll be looking more about reporting the results from our pilot testing. But at the moment for this year, or at least for the beginning of this year, we'll be focusing mostly on defining those items. But from my side, I'd like to thank you for listening to me. And if you have any questions, or if you're interested in joining this work, or you're interested in talking about mental health in general, not relating to this literacy component, just let me know, and I'll be more than happy to help or discuss further.
Thank you, Johanna. Yes, as I said, this is not an interactive session, so we don't have any time for any questions, and we don't have any time for any questions either. I actually prepared some questions for you, but I think we'll save that for another time. If I can get my presentation back, I would just like again to share our contact information to the joint action, and also to myself as task lead for health literacy. You can contact me if you found anything interesting, you have any comments, questions, or you found pieces where we can work together to even better promote the prevention of NCDs across Europe. We'll be more than glad to if you reach out. Also, I would like to just raise your attention that there will be more monthly webinars coming up. I don't know when the next will be. I think it's in the end of the month. So stay tuned and listen in to the information that will be provided to you. This webinar, it has been recorded and will be uploaded into the YouTube channel of the joint action, so you can share that with anyone after this. Yeah. So then I think it's just up for me to say thank you. Thank you for following this webinar, and hope it was interesting. Thank you, and have a good week.